Sexual health is a crucial aspect of overall well-being, but it is also a deeply personal matter. The frequency of sexual activity can vary significantly from person to person, and it's important to recognize that there is no normal when it comes to how often someone should be having sex. This discussion will explore some of the signs that may indicate a woman hasn't had sex in a while. However, these signs are not definitive and can be influenced by many other factors, such as stress, health conditions, and lifestyle changes. The aim is to provide insights that might be helpful for understanding the possible effects of a prolonged period of sexual inactivity. Before continue, please hit the subscribe button for upcoming videos. Thank you. 1. Changes in mood. Irritability or mood swings asterisk. Sex is known to release several hormones that positively impact mood, such as oxytocin, often referred to as the love hormone, and endorphins, natural painkillers, and mood enhancers. These hormones are released during orgasm and can contribute to feelings of happiness, relaxation, and emotional well-being. When a woman hasn't had sex for a while, she might miss out on these mood-boosting effects, potentially leading to irritability, mood swings, or feelings of frustration. However, it's important to note that mood can be affected by many other factors, including stress, sleep, and diet. Increased stress levels asterisk. Sexual activity is a known stress reliever. The physical exertion involved, along with the emotional connection that often accompanies sex, can help lower cortisol levels, the stress hormone. Without this outlet, some women may experience heightened stress levels. This could manifest as feeling more overwhelmed by everyday challenges or being less able to manage stress effectively. 2. Altered sleep patterns. Difficulty falling asleep asterisk. After sexual activity, the body often enters a state of deep relaxation, partly due to the release of prolactin, a hormone that promotes relaxation and sleep. Women who are sexually inactive for a period might notice that it takes longer to fall asleep, or they may not feel as rested upon waking. This change in sleep patterns can be subtle but noticeable over time, especially if sexual activity was previously a regular part of their routine. Restlessness asterisk. The inability to relax fully can lead to restlessness during the night. This could be related to the lack of physical release that comes with sexual activity. Additionally, the psychological impact of missing a regular source of comfort and relaxation can contribute to this restlessness. It's also possible that the absence of the oxytocin release, which helps calm the mind, could make it harder to achieve deep, restful sleep. 3. Physical tension or discomfort. Pelvic discomfort asterisk. The pelvic region, including the muscles and tissues, benefits from regular sexual activity. When a woman is sexually active, the pelvic muscles engage in contractions during orgasm, which can help maintain muscle tone and flexibility. In the absence of these contractions, some women might experience pelvic discomfort or a feeling of tension. This sensation could be subtle, manifesting as a general sense of tightness or discomfort in the lower abdomen or pelvic area. Muscle tension asterisk. Sex is a form of physical exercise, and like any exercise, it helps in releasing tension from the body. The physical exertion and subsequent relaxation experience during sex can relieve muscle tension throughout the body. Without this regular release, some women might notice an increase in overall muscle tension, leading to stiffness or discomfort, particularly in the lower back, shoulders, or neck. 4. Reduced libido. Lower sex drive asterisk. The relationship between sexual activity and libido can be somewhat paradoxical. In some cases, the more a person engages in sexual activity, the more they desire it, due to the cycle of hormonal release and psychological anticipation. Conversely, when a woman hasn't had sex for an extended period, she might experience a decrease in libido. This could be due to both psychological factors, such as not thinking about sex as often, and physiological factors, such as lower levels of hormones like testosterone, which can influence sexual desire. Lack of interest asterisk. Over time, the absence of sexual activity can lead to a diminished interest in sex altogether. This could be seen as the body and mind adapting to a lower level of sexual activity. For some women, this might be a temporary phase, while for others, it could signal a more long-term shift in their sexual appetite. This reduction in interest doesn't necessarily mean something is wrong. It could simply reflect a natural ebb and flow in sexual desire. 5. Changes in vaginal health. Vaginal dryness asterisk. Regular sexual activity can help maintain vaginal health by promoting blood flow to the area, which supports natural lubrication. In the absence of sexual activity, some women might experience vaginal dryness. This can make sexual activity uncomfortable or less enjoyable when it does occur, potentially leading to a cycle where a woman is less likely to engage in sex because it's less comfortable, further exacerbating the dryness. Decreased vaginal elasticity asterisk. While vaginal elasticity is primarily affected by factors such as aging and childbirth, some women might notice minor changes in vaginal elasticity with prolonged sexual inactivity. This is because regular sexual activity helps maintain muscle tone and elasticity in the vaginal walls. However, these changes are typically very subtle and may not be noticeable to all women. 6. Emotional and psychological impact. Feelings of loneliness asterisk. Sexual intimacy is often associated with emotional closeness and connection. The absence of this intimacy can lead to feelings of loneliness or emotional isolation. This is particularly true if a woman is used to regular sexual activity as part of a loving relationship. The emotional impact of not having sex might manifest as a sense of missing out on an important aspect of connection with a partner, which could contribute to feelings of sadness or loneliness. Self-esteem issues asterisk. For some women, not having sex might impact their self-esteem, especially if they associate sexual activity with attractiveness or desirability. This can be particularly challenging if a woman feels that her sexual inactivity is due to external factors, such as a lack of a partner or relationship difficulties. It's important to recognize that self-worth is not tied to sexual activity and that these feelings, while valid, can